on, Eve, think. Oh, this homework is ridiculous. Doesn't my teacher know I'm only 10? What to be when I grow up? And why? I don't know what I want to be. I used to wish I could be the tooth fairy, but I quickly figured out I could be that when I'm a mummy. So basically I just want to be a mum. What I really want to be is a social worker based in an acute care hospital. I wonder what that would be like. Would I sit around all day and drink tea with people? Oh, you're a good little child. Would I randomly take children from their mothers? Oi! Give them back my children! Or would I be swamped in paperwork every day? Or could I deliver best patient care that consumers participate in and own? Could I be a part of a multidisciplinary team that plays a vital role in preventing long hospital admissions and facilitate safe and effective patient discharge? Could my practice be evidence-informed while remaining patient-centred? Could I develop and utilise a targeted screening tool for those patients experiencing a mental health condition or the victims of domestic violence? Could I be highly skilled and have the versatility to work in all areas of the hospital? Could I negotiate the child protection system and effectively interface with the external stakeholders? Could I be a responsive social worker that is able to provide a holistic psychosocial assessment while remaining client-centred and ensuring patient safety? Would I be a team player? But most of all, I wonder what my colleagues would think of me and the social work service I provide.
As a clinical nurse working here in Mapu, I find that the social worker plays a vital role in making sure that our patients get home safely and effectively. They look at things like crisis intervention and also making sure that we're not discharging any patients into any sort of social environment that may be unsafe for the patient or for their families. So I feel that they play a vital role in making sure that the patient gets a holistic care while they're here.
So the addition of having social workers within the emergency department help us enormously to prevent inappropriate admissions and to allow safe discharge of patients.
Hello, my name's Jenny. I'm the NUM of the MAP unit here at Nambour. We've had the pleasure of working with Eve for the past 9 to 10 months now. MAP unit being a very busy place as it is, we depend very heavily on all of our multidisciplinary team members. And we have been either very fortunate or we have a very good pool of staff, but all of the team that we have here have been performing at a very, very high level, and that includes Eve. We wouldn't get anywhere without our social worker. There's many issues that our patients come in with which are not entirely medical, and social work have a huge input into that. And Eve plays a very important part of our very functional MAP unit. Thank you.
So having worked with Eve, I can say that she's very very efficient and effective in crisis intervention within the emergency department setting. She works exceedingly well in bereavement situations with family and next of kin.
Hello, I'm Jen Haynes. I'm a nurse manager at Nambour General Hospital. I've been on duty when Eve's been after our social worker. I found Eve very proactive, very helpful in organising things for patients, very caring about patients and their outcomes. So I would nominate Eve for any position she might apply.
So the addition of social work services within the emergency setting in particular has allowed us to address some of the needs that were previously not being met by current support services.
I see the social work role as a crucial interface between the child protection and inpatient and ambulatory health care. In my recent experience with Eve in the Child Protection Liaison Unit, she modelled how social worker role is an essential component of that holistic health care.
So the addition of social work services in acute medicine and particularly in the emergency department environment has really allowed us a much more holistic approach to assessment and management of our patients that was previously not capable of, or we were previously not capable of providing. And I think that Eve in particular brings skills within this area that are hard to match.